My name is Dr. Janelle Love. I'm a functional medicine physician. I practice in Arnold, Maryland, which is just north of Annapolis in Maryland. And my approach is to look at root causes of medical conditions and try to help patients correct those root causes without a lot of prescription medications. Originally, I was trained in family practice. Back in 2004, a member of my family was having some medical difficulties that traditional medicine wasn't helping. So I kind of went outside the box and learned about functional medicine. And my training includes a master's in metabolic and nutritional medicine from the University of South Florida. I also received a fellowship and an advanced fellowship from the American Academy of Anti-Aging Medicine. I'm board certified in anti-aging and regenerative medicine. And through my training, I've found it necessary to go and get additional certifications just to help patients. And so I obtained a functional endocrinology graduate certificate from the University of South Florida and a brain fitness certification from the University of South Florida. And I find that every time I go to conferences, I find out new and exciting things to actually help my patients. So you look at biochemistry, genetics, physiology, toxin issues, and you try to figure out a root cause, and then you go forward from there. And I find that many patients get significantly better when I do that, which makes my job actually very exciting, because you're a medical detective every day. And you don't know what's going to come in the door. And I've had some patients with depression come in, and we found out it was actually amino acid deficiency. And once we corrected that, they no longer needed their prescription medication. Or I'll have a child who comes in that's on Ritalin. Well, you know, people aren't Ritalin deficient. That's not a normal thing in your body. Yes, it does help, and some people do need to take the medication, but oftentimes we can look at underlying causes and correct those, and they don't need to be on their medication anymore, and the child's much healthier. A lot of patients who come in who are perimenopausal, menopausal, or gentlemen who are in andropause who have significant hormonal deficiencies, and once we start correcting those hormonal imbalances, they can sleep much better, they have a much increased libido, they have less anxiety, their memory's doing so much better, they even feel younger. I've had several patients say that, you know, their friends want to know what they're doing because they look 15 years younger, and we just balance their hormones. I do bioidentical hormone therapy, so we're not using any synthetic hormones. We want to just balance the body. There are multiple benefits to hormone replacement. In fact, progesterone has about 200 functions in the body, and estrogen has about 400. So we're not just looking at sort of symptomatic relief, but we're looking at long-term health and keeping somebody's heart healthy, their brain healthy, maybe decrease their risk of breast cancer, and keeping them alive a lot longer. Most people think of anti-aging doctors as somebody you're going to go get a facelift from, or, you know, you're just going to use topical creams or do aesthetics, but I think it's very important to actually work from the inside out. So that's what I like to do, to look at the biochemistry, the genetics, the physiology, the toxin load, and correct all of those, get those functioning more optimally, because once you get the inside of the body work, you may start looking much younger on the outside or healthier on the outside. You'll get more color in your face, you might have less wrinkles, your skin looks better, you know, you've got more of a bounce in your step, you're in a better mood, and your memory's much sharper, and that's how I like to approach anti-aging, working from the inside out. If you're interested and would like to find out more information, my website is drjanellelove.com.